are going to go ahead and get started. I don't know if you're like me, but you always have your phone, so make sure you turn your phone down. I just turned mine down because I just got a call, so it's like, oh, so do that. So, welcome. Can you guys hear me okay?
Yes.
It just seems like it's not quite as loud. How about in the cheaper seats back there? Can you hear okay? Okay. No? Okay. TJ. I'll have to turn it up. Well, I want to welcome everybody to the Nebraska Savvy Seniors Empowerment Seminars. We see a lot of familiar faces, we see a lot of new faces, so we're glad you came. And if anybody tried to register on the website, I apologize. We are in the process of actually converting from our old one to our new one that has more capabilities for registration and better resources for you. And they turned our old one down before the new one was quite ready, so I apologize for that. The other thing is if you tried to get onto our website to get tickets to the prom, you probably weren't able to, but tickets are still available. And we're going to have a lot of fun. We're doing this for you guys. It's a social event for you, and it's a fundraiser. If we do make any profit off of this, it's going to be split between the Alzheimer's Association, which you guys are real familiar with, and then Dreamweavers. Who does not know about Dreamweavers? Does everybody know what Dreamweavers is? Okay. So what Dreamweavers is, you know what Make-A-Wish is? Yeah. So this is Make-A-Wish, but for older adults. And how they screen their people that they can grant their wishes to are you don't have to be on hospice on your deathbed. That's not what they want. They want you to have an experience where you're still able to enjoy it. So if you have been diagnosed with some kind of terminal condition, then you can be nominated for a Dreamweaver's wish. And sometimes it's just a big dinner to go out to dinner with all your family. Sometimes it's a fishing trip that you'd like to take, a couple's getaway, have a family member flown into town, and just all those little things that, could be one of those things that you would have wished that you would have been able to do. So that's what they do. So that's what the event is going to be raising funds for. We are going to start the evening from 5:30 to 6:30 is social hour, and we will have a magician, which Lucky Dog Property Solutions has graciously provided for the evening. And then we will have our catered dinner, and then we will have Bill Craftsfield do a show. And we have things for a silent auction, we have a photo booth, and there's going to be a sugar rush pool, which is, I don't know what it's going to be, but it's something where you pull something, I don't know, off a wall and you get pop, vintage pop and vintage candy. So that's what Dreamweavers is doing that for us. So we've got an evening pack full of really fun things, and you still have time to get your ticket. We do need to get those pretty quickly because we do have to have our catering numbers in and all finalized. But you can see any one of us. There's me, there's TJ, there's Rose, there's George. Any of us can sell you a ticket here today. And if you want to pay for it with a credit card, I think TJ has his laptop now, so we can even take a credit card payment. So be thinking about that. I do want to welcome you again to Nebraska Savvy Seniors. And for those of you who are here for the first time, what we do is we provide monthly seminars, and they're free of charge to you. These are not sales events. We do not sell anything here. This is not a networking event where people will come and talk to you about their business. And if they do, make sure you let us know, because that's not what this is about. This is about offering services to you and education and getting to know you and providing some information so that you can make decisions that make you informed, equipped, and empowered to make you the best life possible. So that's what we're here for, is we are here to educate you and help you and to be a resource for you. And we have a couple panelists here today that it's our honor to announce, and I'll just introduce them. We have Dr. Mary Spivey. She is Lincoln's only gerontologist. And so we are delighted to have her here today to share what she knows about your healthcare choices. And then we have Maya, and Maya, I cannot pronounce your last name. Manjaras, okay. And so she is with Archwell Health, and they have a totally different concept for healthcare. It's another one of the choices you might want to make. So we're talking about healthcare choices. and why it's important for you to have a personalized plan. And your plan should reflect your individual needs, not your neighbors, not maybe your husband's, not your kids' choice, but yours. And you need some clarity on what's covered, what's not, and what are the real costs that are involved here. And you might want something that's also convenient for you and your lifestyle, something that's accessible for you and that's affordable. And you want to work with providers that you know and you can trust, and providers that will listen with you and be your partner in your healthcare journey. And you deserve this, and you deserve this clarity. So we're here to answer some questions for you today. And we will just get started with the questions. And I have some questions for either one of you, and whoever would like to pick up the mic can do that. We'd just like to know, and if both of you want to answer the question, that's just fine. This is just kind of like a conversation we're going to have. We want to know why it's important for seniors to understand that healthcare isn't a one-size-fits-all.
Yeah, I think it's on. Is it?
Yeah.
Okay. Good morning, everyone. My name is Maya Manjarez, and I am an adult geriatric nurse practitioner. Okay. So I think it's important, and first of all, I think that's a really good question. The one size doesn't fit all. We're all individuals with different complex needs, different chronic conditions. So what might work for a 75-year-old, active marathon runner might not be the same care that another 75-year-old, maybe stroke survivor has.
Yes, I think what Maya says is valid. One size fits all, that doesn't work for anything in life, right? So your house is your own individual space. Your children are raised differently, and we all come from different backgrounds and have different values. And so I think it's really important that you find a healthcare system that reflects your values and also takes into account your healthcare needs. So like Maya said, I deal with a lot of different people with a lot of different medical situations. And so making sure that someone is there to balance those medical situations and take your priorities and choices into consideration is very important.
Good. Well, can one of you answer, or both of you, how can seniors become more involved in making their own personalized healthcare decisions?
Yeah, so I think the main thing is to just ask questions. Whenever you're at the physician's office, don't feel like you're being brushed aside. Bring your list of questions, make sure that they're all being addressed. I always tell people to bring a partner with them, whether it's your child or a friend. It's always good to have somebody there that's your advocate, that's with you, who can remind you of your questions, who can be a second set of ears in case you forget something down. They can write things down for you. So that's kind of my main approach to making sure that just asking questions and making sure that your questions are answered.
I completely agree. Also, building a relationship with your provider and the staff at the clinic, being familiar with what the clinic offers. Do they have a pharmacist? Do they have a social worker? And also word of mouth, talking to your friends, neighbors, what kind of care do you receive? Where do you go? What is your plan? What does it cover? What does it not?
Okay, good. Well, what are now some of the most common misconceptions that people do have, and especially, 55 and older, about healthcare options? What would those be?
For me, what I see is certain things that come with aging, pain, fatigue. People tend to think, that that's a normal part of aging. And while it might be, there are things that we can do for it, and you don't have to live with pain, chronic fatigue, sleep difficulties. So I think a lot of people think, well, that's just part of aging, that's just the way it is, and that's how I live my life. But there are treatments, therapies, and other things that we can help you to surpass that.
She stole my answers, let me tell you. Yes, so basically, if you have a symptom that's interfering with your life and is making it so that you're not able to do the things that you would want to do, that is not what should be considered normal for you, and we should be able to find a way to alleviate that, or bring in things like physical therapy or occupational therapy to create ways to help you live your life. The other thing that I see specifically for healthcare options is that people sometimes don't realize that there are different types of healthcare systems. So I do geriatric consults. I know a lot of you are just kind of familiar with your primary care, and I think we'll talk a little bit about the difference between that a little bit later on. But there are programs like PACE that are dual eligible Medicare, Medicaid programs. I don't think they have one in Lincoln, but they have one in Omaha. And those can be some really great options for healthcare. I know Archwell has its own specific type of healthcare that can be, for a lot of people, probably a little bit more inclusive than a traditional PCP office. But just knowing that you can kind of shop around and ask, and that it's not all the same. It's good to find a provider and a practice that matches what you need.
Okay, great. Well, lots of times seniors have more than one thing wrong with them, like, your foot hurts, your back hurts, you can't sleep. How do you handle that, and how do you create an individualized care plan for patients, especially us that are older, when there might be multiple health concerns? Do you just see one doctor for everything, or what do you do?
That is a really good question. So typically for me, at least, that's something we call a geriatric syndrome. We call it multi-morbidity, or having multiple different healthcare problems. And normally that comes with multiple different medications. And all of those medications, we know if you have more than 5 medications, you have a really high risk of having medication interactions or side effects from those medications. So it's important to be sure that you're having those medications reviewed, and that you have someone who's taking enough time to address all of your medical problems together. I would say there is a role for specialists, and I say that tongue-in-cheek because I'm a specialist. But ideally you want to have people who are addressing the whole person, not just your hearts, not just your kidneys, right? So traditionally primary care is that person that should be pulling all things together. Geriatrics does that as well. So when I see patients for their first visit, I have 90-minute visits, and we go through your entire health history. We go through your social situation and your functional situation, and typically what I do is I pick kind of the top 2 or 3 things that are affecting usually your pain or your mental well-being, and those are usually the things that I try to focus on first. Whatever is bothering you the most should be what your physician is addressing first. And I typically will see people back. You don't want to, with all of those medical problems and all of those medications, you don't want to make too many changes at once, because then you don't know which change was it that was made that made this difference. Are you having a side effect from something? Well, now we don't know because we've done too many things at once. So typically what I'll do is I will see people for a very lengthy first visit, and then have them come back in about 4 to 6 weeks, and we'll address other things 1 at a time or 2 at a time as we go forward.
Great response, thank you.
Great, thank you. Yeah, picking off of that, at Archwell too, our first initial visit is about 60 minutes, and then we have a close follow-up, about a 2-week follow-up. But in that first visit, I do like to ask, I know there are things that I want to talk about, and I want to get to know you, but what is bothering you today? Is there something that you really want to talk about today? And kind of just setting an agenda so that we can address both the needs. At times, due to time constraints, it's not possible or safe to try to address 10 different things. So that's why we do have a closer follow-up. So we have the 60-minute visit, initial visit, a 2-week follow-up, and then we touch base about every 3 months, depending on someone's needs. If they are higher risk, then we do like to see them earlier, about every 1 to 2 months.
Well, that's awesome. 60 minutes, 90 minutes visit with your physician on a one-on-one. Sounds like you guys are really on top of your game as far as getting to know your patients. However, we've all been to those doctors that don't really listen to us and they're writing stuff down and we got 10 minutes and we don't feel like they really were listening to what we said. What do we do if we feel that that's the case? How can we change that, or what would you advise us to do?
Again, I think the ability to just speak up for yourself and to bring an advocate can be very helpful. If you feel like you're just being blown off, or that they're just saying, well, this is because you're older and this is what's going on, then that's kind of a red flag that maybe that's not the best provider for you to see. I think we all kind of have those feelings, right? So maybe one day the clinician is rushed or is behind and things like that. So you can give them a little bit of grace. But if you're consistently going to see a provider and they're consistently not addressing your needs, then you really should be looking for somebody who is going to take care of you and pay attention to the things that matter to you. But yeah, I think speaking up for yourself and bringing somebody who's able to speak up for you is really important.
Completely agree. One thing I always tell people, if you feel like your care isn't helping you feel better, it's not helping you function better or live the way you want, then it might be time for a second opinion. If you're feeling worse and you're not feeling better, if your symptoms aren't improving, it might be time to ask, is this the right plan or is this the right place for me? We did talk about feeling rushed or unheard at appointments. And also it's important to understand your medications and what you're taking them for. If you are taking too many medications but don't know what they're for, you may have some side effects like dizziness or falls, and it might be time for a medication review. It's also important that your goals and your values are being considered with your primary care provider.
Okay, well, we all make choices every day for our health care. Some of those choices are our diet, exercise, or mental health. Can you talk about how those play into our health care planning?
Yeah, so those play a huge role, just like they do when we were younger. They play a huge role as we get older, and specifically when you're thinking about your function, right? So the ability to stay physically active, whether it's formal exercise or whether it's just getting out and walking, making sure that you're using your cane or walker or whatever is needed, and avoiding things like using scooters and wheelchairs if it's safe for you to do so, because if you don't use it, you lose it, right? And so those things carry over into needing more and more assistance and becoming more frail. So staying physically active is huge. And then staying socially connected, I think about for mental well-being is very, very important. So a lot of times we isolate ourselves because we're feeling down, and we know that if you're having depression or any kind of cognitive issues, that isolation is the worst thing you can do for yourself, right? You really need to get out there and talk to people and be heard and seen, to take care of your own needs. Diet is also tremendously important. We all know that a Mediterranean diet can kind of really help decrease inflammation, which can really help us lose weight and stay fit and get enough protein. All of those things are very important for our overall health, just like any age.
Yeah, so I, believe that wellness is more than just staying alive. It's about living well. So it is important to address not only just, your physical health, that's one area with the medications, safety, but also checking in on your mental health and your mood. I always also ask about connection. Do you have someone to talk to you? Do you have a neighbor if something is bothering you, if you feel down? Do you have someone that you can rely on and talk to? And if the answer is no, then we kind of problem solve that together. Also, I'd like to know, people's hobbies, their purpose, their joy, what keeps you moving. Do you like to garden? Do you like to knit? Do you like to play cards? I want to know what brings meaning to someone's life and how we can protect it.
Okay. Well, can you tell us, as far as our healthcare options, what kind of screenings are provided and what preventative measures are most important for people, say, 55, 65 and older?
So probably the biggest thing that I talk to people about is avoiding falls. So we can all kind of worry about our hemoglobin A1C and our cholesterol numbers and things like that. But the older we get, kind of those things kind of start to decrease in importance, because what really is most important to most people, or very important to a lot of people, is staying independent as long as possible, right? And so avoiding hip fractures is a huge, huge thing, because we know that hip fractures can cause moves, they can cause death, they can cause just a huge disruption in life, other call it morbidity in medicine, but other kind of medical problems that come from falls. So making sure that you have kind of a home safety plan is very important in terms of medical screenings. Again, those become a little bit less of an important factor. It's good to know though that there isn't really a specific, so for colonoscopies, they talk about, you know, if you're age 75 and above, you don't necessarily need a colonoscopy anymore. That's if you've had only normal colonoscopies, right? So that doesn't mean that if you've had an abnormal colonoscopy that you shouldn't be getting a colonoscopy. So that's specifically for screening. When you've had problems before, we call it surveillance, and so that's an important thing to kind of keep in mind. It may be that you still don't need to have that colonoscopy, but it's something that shouldn't just be thrown away because of your age. They should explain to you why it is that you don't need it, and a lot of that has to do with kind of your projected projected lifespan, right? And so same thing, I talk to people with your hemoglobin A1C and diabetes. I worry a lot more about low numbers than I do high numbers. So if you're not under what you used to call perfect control, that's usually okay with me, because we know that the low numbers are more likely to cause you to be dizzy and fall and have some of those adverse events, whereas the higher numbers, they take like 10 years to start to create side effects. So in the acute setting, it's really not that big of a deal. I do think breast cancer screening is still very important as we age. Mammograms are pretty easy to do, and lumpectomies and treatments like that are pretty non-invasive. And so if you can prevent someone's breast cancer from developing into a metastatic disease, then you've made a huge difference in their life. And if you catch things early, which is the point of a mammogram, then you can make those changes if you need to. Thank you.
So a big part of our job is helping seniors understand that getting older doesn't mean giving up on health. You know, it means staying engaged, asking questions, continuing with the screenings. So preventive care does matter. Many chronic conditions like diabetes, high blood pressure, cholesterol can develop silently. So catching them early can prevent complications. So I would still continue with the yearly screenings, and also the mammograms, the colonoscopies, the DEXA scans. So just be proactive about, you know, your screenings and your education.
Well, what should seniors consider when they're choosing a new healthcare provider or they're wanting to switch doctors? What should they be looking for?
I think the clinic as a whole, you know, not what the clinic looks like or where it's at, but what services do they have? Do they have clinicians that specialize in geriatric care? Do they have a pharmacist? Do they have a social worker? Location, it can matter, you know, is this somewhere that provides transportation for me because I don't drive, or can I, you know, is it not too far from where I live and I can drive in the winter conditions? Or do they offer telehealth? Can I do a telehealth phone visit instead of coming in to the office?
Yeah, so I think as we age, our needs are a little bit different, our priorities are maybe a little bit different. One of the things that I think you should kind of look for or listen for is making sure that your provider is asking you how you're doing with your daily life, right? So how are you functioning? Is this problem affecting the way that you're able to live your life? More so than what is your number on your cholesterol test, right? So really the thing to be listening for and looking for is somebody who's taking your whole life and your priorities into consideration. I talk to people, you know, if you are 75 and the only medicine you take is a multivitamin and you're playing pickleball 5 days a week, you probably don't need a specialist like me necessarily. You could probably be just fine with a regular PCP because your medical needs are not that high. Where you start to have more medical problems, or you start to realize, like, I'm on 10 different medications and I don't really know what is going on with all these medications, then is the time to kind of start looking for somebody, potentially an internist or a geriatrician or someone who specializes in older care, to be sure that they're taking all those things into consideration.
Okay, well, Maya, I have some questions for you. Can you explain the difference between a nurse practitioner and a physician, especially when it comes to your healthcare choices and managing chronic conditions? What can you do and what can't you do, or what is your scope of what you can do?
Practice, yeah, great. So we both, nurse practitioners and medical doctors or physicians work together. We collaborate to treat the patient as a whole and to treat their medical conditions. One of the main differences is the training and the education. So prior to being a nurse practitioner, I practiced as a hospital bedside nurse. So that was a 4-year program for nursing. Once you get done with your nursing program and you want to advance your career and you want to practice and treat patients, you can decide to get your master's or a doctorate degree in nursing and practice as an advanced practice nurse. In those programs, there are different specialties that you can choose from. So you could do primary care, family care, there's OB-GYN, pediatrics, acute care in the hospital, and the track that I did was geriatrics. So most of my training was in skilled nursing facilities, geriatric facilities. So we both, basically treat the patient. We are there for the patient. We collaborate together. But in times, the doctor's training, it's a little bit more intensive. So they are trained to handle more complex cases.
Okay. Well, many seniors see multiple specialists. How do you coordinate care to make sure that nothing slips through the cracks? Either one would be a really good answer.
Yeah, so it's not uncommon, for people to have a kidney doctor, a doctor for their diabetes, for their back, and part of it is staying, in touch, touching base with the patient, following up with them after they see their specialist, requesting the specialist notes, reviewing their medication changes, and then also asking the patient, what happened at your visit with your rheumatologist? What did you understand? What did they tell you? Were there any medication changes? And so just following through with all the specialists.
Okay. And then Mary, I got a question for you. What unique insights does gerontology bring to senior care that a general practitioner might overlook or might not be educated in?
Yeah, so geriatrics, typically what I train in as a geriatric fellow, I did internal medicine and then there's extra training in geriatrics. We really deal with things called geriatric syndromes. So these are things that are not necessarily normal as we age, but are very common as people age. So things like incontinence, things like cognitive impairment or dementia, things like polypharmacy or having lots of different medications, or multimorbidity, having lots of different medical conditions. We do special training in those and trying to balance the pros and cons of being on each medication, the pros and cons of how aggressively are we going to treat your heart disease or your kidney disease or these things, and really help people with those syndromes prioritize their overall individual health goals. So I think a big thing that's missed in primary care typically is polypharmacy, right? My goal with my patients when I see them is to see if I can get them off medications. And it's always good to have somebody always considering, do you need all of these medications, and what could I potentially get rid of? Because we know that they all have the potential for having side effects.
Okay, great. And what advice do you give to seniors who are considering moving to a senior living community from a healthcare perspective? What would you tell them?
So senior living communities is primarily there for social support, right? So to help with things that medical care doesn't necessarily do a great job helping with. So making sure that people are staying engaged, that you have opportunities to be around other people. Definitely from a medical standpoint, those senior living facilities can be really, really important for making sure that you get enough meals. So if you're having trouble cooking at home or getting your meals made, going to one of these facilities can be really important. Or if you're having difficulty because you're on multiple medications or having trouble managing your medications, then those things are lifesavers for people, literally. So particularly if there's a problem with cognition, so if there's dementia, even if it's early dementia, it can be very beneficial and help keep people more independent, actually, to go to a place that can support them a little bit better.
Okay, great. And this question could be for either one of you. What trends are you seeing in age-related healthcare that can benefit seniors today? If they're informed and proactive, what are some benefits of what you're seeing today coming in? Are there any new trends or anything that you see differently?
Well, I think that we're noticing that people are needing individualized care, right? Not everybody needs the same exact plan, which was kind of the way that medicine was going for a really long time. So I think unique programs, like I said, like PACE or like Archwell are important, going to geriatricians. There is thankfully some understanding that we need to do something that incorporates things a little bit more than traditional medicine necessarily was.
Yeah, and because of that, and because there's more access to resources, we are also seeing that patients are living longer, healthier lives, and just that they can build a community like this group here. At Archwell, we also have an activity room where we can gather and play certain activities, so you can also network and get to know people and reduce that risk of social isolation. So just more healthier and active seniors that are informed of their care.
And without getting too much into the different types of healthcare plans, you know, there's original Medicare, there's Medicare Part C, Part A, Part B, whatever, you know, it's kind of an alphabet soup out there. There's a prescription plan, and there's Medicaid, there's VA benefits, there's private health care insurance, and there's long-term care insurance, and there's actually home health too. What are some of those options, and how do you figure out for your patient which ones are the best for them? Or is that your place, or how do you help them?
Yeah, so choosing a new provider or making insurance changes, that can feel overwhelming, especially when you have a lot of options, or maybe you don't know that you have a lot of options. So one thing to consider when you are changing your insurance plan or looking at a different clinic clinic is to see what your insurance plan specifically covers. Do they cover this provider? If I move to this clinic, will they cover my specialist? Will they cover my medications? What will be covered, what will not? There is also a helpful tool on Medicare.gov, and that can kind of show you your plans and the benefits and the pros and cons. And we also do have marketers at R12 that can help you look into your plan, your benefits, and also look into other plans.
So I am terrified of all of the different plans. So I will admit that in many cases I am probably at as much of a loss as any of you are, right? So really this is where social work really plays a huge and vital role. So I know there are different social workers, so if your clinic has a social worker, they can oftentimes help you look into what different plans might have available and what makes the most sense for you. I know at Aging Partners, they have different caregiver planners that can look into individual resources. And so really finding somebody who has expertise in that area. As provider, I don't do much directly with choosing different insurances, right? My dealing with it is that I bill, and if an insurance needs me to, then I fill out extra paperwork to make sure that I get whatever prior auth that's needed to get the information that you know. But reaching out to resources like Aging Partners, I know there are senior advisors, Oasis I know is here, Bridge to Better Living, they would probably have a little bit better resources and knowledge as to where that might be. I don't know if anybody else, I know there's a lot of senior professionals, yes?
Well, I believe Danielle, one of our educational sponsors, could also be of assistance on some of the insurance. Who's the other gentleman, Alicia, that does insurance here?
What was that?
Who's the other insurance representative that's at
So we have Danielle Knive with A New Dawn, and we have Dave Tuttle with American Senior Benefits. And Danielle had a sick child and had to leave, and Dave just had surgery. So, but we do have a seminar on Medicare, Medicaid, and all those kinds of options coming up later this year. You can look on your table, and we'll go into depth about those, because if Dr. Spivey is terrified about it, you can imagine how we feel, right? So we do want to help you with that too. And I think October is open enrollment month, so that we might have that down in October to help you out and help you with those kind of decisions. Did that answer your question, Val? Okay, great. And Val does provide really good in-home care, and that is another healthcare option too. You know, if you don't want to go to senior living, but you just need a little bit of help, you just need a few things done, that might be an option. I know I used to provide in-home care. Thanks to Carol McShane, she hooked me up with a wonderful family, and I helped them for about 10 years, and she's another great source in our community too. Can you explain, Dr. Spivey, how can social isolation impact a senior's health? What do you see, and what role does your healthcare choices and providers play in addressing that?
Yeah, so I sort of touched on this before, but social isolation is a huge risk factor for all sorts of things. So it can it increases the chances of cognitive impairment, actually, because you're not exercising your cognitive skills, you're not interacting with other people. It can make hearing worse because you're not using those hearing, which can further worsen cognitive impairment. Makes people depressed when you're just sitting out alone. One of the things that our clinic does is that if we find that somebody is really struggling, we try to find different ways to help them get out and about and really try to find different activities that are interesting for them. A lot of people, as you may know, will say, I don't want to go to the senior center because I'm not old enough to go to the senior center, or similar types of things, right? So finding something that people are willing to do is the biggest thing. So a lot of times I do think the senior center is a great place. Aging Partners has some really great programs, whether you realize it or not. I would definitely advocate for going and checking them out if you never have. For some of our socially isolated people, we talk to them about this, the aging partners will actually, if you can't drive, they will come pick you up and take you to the senior center. So that's a huge benefit for a lot of people. Another thing that I talk to people about is doing programs through the Osher Lifelong Learning Institute, or OLLI, which you guys may or may not be familiar with, but it's through the University of Lincoln. And it's specific educational programs for older adults, and they can be all sorts of different interests like botany, the guy who runs it told me that he has a class on what beers to drink with what meals, maybe World War II history if you're a history buff. They have just all kinds of things, and so it's great to kind of reach out and look, thinking about things that are at your church or different community centers that resonate with the values that you have. Just kind of staying busy and finding those things that work for each individual person is important.
Okay. And both of you talked a little bit about your clinics. Can you tell us, when we come into your clinic, Dr. Spivey, what are we going to see? What services do you provide there? Are you the only physician there? Do you have others? And where are you located? Can you kind of tell us what that experience would be like?
Sure. So I'm located with Common Spirit Health, or CHI Health. I'm in 2 different locations. I work out of East Lincoln Internal Medicine, which is on 70th and Pioneer. And then I also work out of Yankee Hill Clinic, which is on 40th and Yankee Hill. So at each of those clinics, there are multiple providers. East Lincoln Internal Medicine is just internal medicine providers, so all for adult medicine. And Yankee Hill has a variety of different things. Both of those places have radiology and a DEXA scan, so if we need those things, we can get them. Both of those places have a lab, and then at Yankee Hill there's even a pharmacy. So those are some of the things that are provided. Yankee Hill also has physical therapy and occupational therapy in that facility as well. So if you're looking for wanting to kind of keep things all within one facility, maybe Yankee Hill would be a place to consider, because you can kind of one-stop shop there. I think that's the plan for our other clinic as well, but that's down the line. When you come to see me, so like I said, my visits are 90 minutes, so usually the first 15 to 30 minutes are spent with the nurse, and she will do a really thorough screening. She does something called a tug test, which is watching you walk back and forth, which is important to screen for falls. She'll go through a depression questionnaire. We do orthostatic vital signs for all of our people, which is kind of unusual, and so that these are mostly things to look for falls as well as for depression. And then when you see me, I will go through and talk to you about what's important to you, kind of your past medical problems, but really focusing on what are your concerns today. I do a lot with mental health, so whether it be depression or cognition, anything to do with the brain, I really focus on, and then falls, and then taking meds, trying to get rid of meds is my favorite thing to do.
Okay.
Right.
So I'm at Archwell Health, and that's a primary care clinic for seniors. So we treat patients 60 and up. And so we are located off of 48th and O Street. It's right next to a Super Saver. It used to be the old Dollar Tree, and there's a Chick-fil-A. So I see some heads nodding. Yeah, you guys know where that's at. And so we are, this is our first clinic here in Lincoln. We do have 3 other clinics in Omaha, and we opened up in March, and there are 2 providers. So we have Dr. Harthorn, who works with us, and then I'm the nurse practitioner. We both have our own set of panels to see patients, but if there comes a time where he's not in or I'm not in, then we do see each other's patients. So you will always have someone to see. We provide medical services, treat chronic conditions, and we also offer same-day sick visits. So say you wake up with a sore throat or a headache and need to be checked out that day, then we have those open slots for you to come in. We have an activity room where we have different activities for the month. Bingo, trivia, if it's National Chocolate Chip Day. We do have a crocheting class, knitting class. So you come in, your initial visit is 60 minutes. You check in with the front desk. Prior to that, when you do meet with one of our marketers, we do give you a sheet where you can list all your medical conditions, all your surgeries, specialists that you have seen, and preventative screening. So you'll bring that all in, you'll get checked in. The medical assistant will get your vital signs and then also complete the cognitive screenings, the depression screenings, the fall screenings. And once that's done and completed with, then I will come in, or Dr. Harthorn will come in, depending on who you see, and we go over all of your medical history and any concerns that you would have for that day, and then schedule you a close visit, a 2-week follow-up, so we can, in that time, get your previous medical records and just close any gaps at that 2-week that we may have had that we couldn't get to on our first visit. We do also offer transportation, so that can also be a barrier, but we do offer transportation to our medical appointments.
And don't forget the coffee and snack bar.
Oh.
That's
They
really
have
important.
coffee and snacks.
We
So-
do.
I wanted to add, so similar to Maya, I do try to make my visits as easy for you as possible. So once we get your referral or you self-refer, then my nurse is automatically asking you who your providers are and trying to collect all that information beforehand so that we have as accurate of a picture as what's going on as possible. I also, particularly for my first visits, do go out of my way to make sure that I'm communicating with all of your providers, and I think that's a really important thing to look for. I send my notes to them. I may make changes because of my geriatric expertise in something that maybe one of your specialists had started you on, and I think that that's really important to really make sure that we have that closed loop communication. So I always make sure to have that information, send it to the providers, and I also type out my instructions really clearly when we have something so that it's all written down and you can have that to refer to later.
Well, you both sound like really cool doctors to go to. And what if I wanted to change my doctor, go and say I'm going to another doctor, but I like you guys, and I want to choose one of you? What do I have to do do I have to tell my doctor? Do I have to have that discussion with my doctor? What do I have to do to change? Because that would be an uncomfortable conversation.
It can be uncomfortable, yeah. So I am actually not doing primary care right now, unfortunately. I am just doing consults. So you don't have to dump your doctor to see. You can come see me like any other specialist. I do a really thorough job of going through things and staying in touch with your primary care doctor. So I think a lot of my patients actually see me more often than they see their primary care doctor, and I try really hard to be an easy person to reach out to. So my nurse is really good about listening to problems, anything kind of mental health and cognitively related I can deal with, any kind of falls, any questions about polypharmacy. And if I'm not the right person, I will find the right person and get you to them. I try not to kind of shove things to the side. I try to find the solution for you even if it's not me.
That's good to know. You don't have to dump your doctor to go to see Dr. Spivey.
So yes, I think I would take this advice to wherever you decide to go. But if you are interested in switching your primary care, it'd be important to actually go to that facility, receive a tour, meet the staff, meet the providers, see what services that they offer, and also talk to your other friends and partners too, and see, you know, are they happy with the medical care that they're receiving, and do they have any recommendations for you?
And I just, one more follow-up to your question, Dr. Spivey. So they would go and consult with you, and then do you call or do you send records to the other specialists that they have, or the other primary care physicians? How does that work?
Yeah, so whether they've told their doctor or not, I will send my note to the doctor. So if you're seeing your primary care, you're seeing the kidney doctor, you're seeing the cardiologist, you're seeing the endocrinologist, I will send my notes to all of those people. So that they're all in the loop as to what's going on. I may not send my note to your podiatrist or something, you know, it's something that they're not gonna really change anything based on what I do.
When do you know when it's time to add on gerontology?
Yeah, so when should you see a geriatrician? That's a great question. Again, 75 playing pickleball every day, taking your multivitamin, probably don't need me. But if you have any of those syndromes, and so specifically if you're having kind of depression that's not being well managed with your primary clinic, if you're having any kind of cognitive questions, whether you think that you have problems with your memory or not, sometimes there are even things that are medication side effects that could be causing problems with your memory, and so kind of looking into all of those things. So anytime you have something, I'm kind of this nebulous person, so you have kind of a weird question or something that seems to be including lots of different things, that's the time. So if you're taking multiple medications, it's a great time to come see me.
Do you suggest coming to see you as a baseline and maybe following up, you know, maybe in 3 to 5 years if nothing's changed? Or
Yeah,
something like that?
so I do see a lot of people for that. They'll just say, hey, I want to do a baseline, just general overall of my health. And I think that's a great idea for a lot of people. I can go through your history and look at your medications and see if everything's great. Some of those people, if you're really healthy, I'll say, hey, just call me if you need me, right? And some of those people will say, why don't we have you come back in a year? A lot of people also just want a baseline for their cognitive health, and I can do the cognitive health screening to look for, do you have just normal aging? Do you have mild cognitive impairment? Is there some dementia here? So we can get a baseline, and then usually I'll have those people come back in either 6 to 12 months, depending on kind of where they fall out in those things. So yeah, I think that can be a great option for a lot of people.
And Maya, at what point, or do you refer patients to a gerontologist like Dr. Spivey or other type of specialists, and how do you do that?
Yeah, exactly. So we first start, you know, with conservative measures or the less riskiest things, and this all depends on also talking to the patient and wanting to know what matters to them and what their goals are. Sometimes we think we know best and we think we know what the patient wants, but it's not until, you know, you get to really talk to someone, and that's the benefit of having longer visits, is to be able to get to know their patient, to know the patient and what their goals are. So yes, just trying the least, you know, minimal invasive things, therapy, stretching, medication, and then once we get, you know, imaging, all that kind of stuff first, and once it gets to the point where it's not manageable or the patient is requesting to see a spine specialist or surgery, then definitely would send a referral.
Okay, great. We're gonna hold all those questions because it's time for a break. Make a note so that you don't forget, because when we come back, that's what we're gonna do, is you guys get to ask them the question, okay? And so grab another cup of coffee or a cookie. We'll be back here in 5 minutes, okay?